Section 9. Tools for Non-Physical De-escalation. This section includes recognizing the potential for conflict, communication, and managing conflict.
There are times when a relationship can be challenging in healthcare. The 2005 National Survey of the Work and Health of Nurses reported that 34% of nurses had experienced a physical assault, and 47% reported experiencing emotional abuse. In long-term care, emergency, and mental health settings, perpetrators are commonly patients or family members, while colleagues and supervisors are most often responsible for the unacceptable high rate of psychological violence. Statistics Canada identified that in 2007, almost 1 in 5 violent incidents in Canada occurred at work, and in 2009, the Ontario Ministry of Labour identified healthcare as an area associated with a higher risk of violence. More specifically, the research has shown that assault rates are more than 10 times those in non-health sectors.
Therefore, understanding why conflict develops and learning how to de-escalate a situation are key factors to managing a challenging relationship. Self-awareness is important when managing escalating conflict.
Establishing mutual goals is the basis for prevention.
There are many reasons behaviors escalate. Most importantly, we need to understand the context in which conflict occurs. You may not be able to control the precipitating factors, but you can control your own responses to the behaviors. A person might react when they feel they have no control over the situation, feel powerless, or have a lack of trust. Experiencing a loss of dignity or a lack of self-esteem may result in a person reacting as a defense mechanism. When a person is uncertain of the outcome, they may feel completely defeated and alone, and may be reacting to fear. If a person is cognitively impaired, they may not be able to process information appropriately. Feeling powerless may be the result of a sense of failure and can result in displaced anger. Wanting attention from others may result in inappropriate attention-seeking behaviors. Other factors such as hunger, pain, insomnia, or a mental health crisis can also contribute to a potential conflict. Everyone has a different limit for personal space. This can be influenced by our culture and individual experiences. Typical personal space is an arm's length away up to a meter. Recognizing that personal space varies is a key element to diffusing a situation. If a person feels their space is being invaded, this could be perceived as a threat and trigger anxiety or agitation. As a care provider, we must remember that a potentially violent person may need a larger personal space, so it is vital to observe the nonverbal cues, such as tightening facial muscles or a person stepping away from you. Your tendency may be to move toward the person in an effort to provide comfort, but interpreting the cues and giving the person space is critical to a successful de-escalation.
Research indicates that we need to be aware of the messages we are sending with our body language. 55% of communication comes from nonverbal cues such as facial expressions, body stance, and tone of voice. Studies have also indicated that as little as 7% of a receiver's comprehension of a message is based on the sender's actual words. 38% is based on paralanguage, the tone, pace, and volume of speech. If a person is trying to tell us how they are feeling, and we are dismissive or disrespectful using nonverbal communication such as rolling our eyes, this could lead to escalating behavior.
How we say what we say has a large impact. It is important to use a calm tone, reasonable rate, and to speak at an appropriate level for the situation. Focus on not speaking too fast or being louder to control the situation. Care providers need to recognize that their behavior has a direct effect on the behavior of the person in crisis. Remember to be patient by remaining calm, being empathetic, and using active listening, which allows us to avoid judgment. These are integral factors to ensuring a supportive approach.
We need to understand behaviors, including our own, before we can diffuse or de-escalate a situation. When a person becomes anxious, they may exhibit behaviors including pacing, wringing of hands, speaking quickly, or the drumming of fingers. To diffuse anxious behavior, it is important to be calm and sensitive to what the person is going through while taking control of the situation.
A person who becomes defensive may question authority and exhibit hostility, which may lead to more violent behavior. Healthcare providers need to communicate in a courteous and non-confrontational way and focus on the issue rather than on the individual. Listen with empathy and see the conflict from the other person's perspective. Options should be given to gain control of a situation, focusing on positive outcomes, as negative outcomes may inflame the situation.
Let's discuss an example of these behaviors and the best approach to care. Mr. Smith is upset because his family hasn't visited for several days. He is pacing and starting to get agitated. For example, as a care provider, you could sit with Mr. Smith in a non-threatening way and using a calm demeanor ask him to share his feelings.
If Mr. Smith's behavior starts to escalate and he becomes unreasonable, not wanting to talk about it, the best approach is to provide Mr. Smith with choices. You might ask, "Would you like me to call your family to see when they will be in?" This approach ensures Mr. Smith's decision-making is respected and he is still in control of the situation. People can display defensive behaviors in many ways. As the situation escalates and the person does not respond to a supportive approach, the person may start to challenge with interrogating or always asking why. The best approach is to answer these questions reasonably and calmly so the situation does not turn into a power struggle. A person who is defiant will refuse to cooperate or collaborate. It is important to set limits, but limit setting should be approached as objectively as possible and should not be done in a threatening manner. When emotional outbursts occur, it is important for care providers to respect the need to vent, ensure a safe environment, and allow time to de-escalate. The care provider needs to remain calm during these situations in order to achieve a successful outcome. Listen to what the person is saying and how they are saying it. Clarify what they are trying to articulate. Listen to what the person is saying and provide an opportunity for them to express their feelings. Don't judge, listen without interruption. This video reviews behaviors and the approaches that support de-escalation. Click on the image to access the video. Everyone reacts differently in a crisis situation. The fight or flight response is a psychological effect that occurs in reaction to a stressful situation. As a care provider, an effective outcome to a crisis situation would result in optimizing the fight or flight response. The heightened response is exhibited by greater speed, strength, and acuity of senses that produces a faster reaction time and allows for a more effective response to the crisis. An ineffective reaction would occur when a care provider overreacts and creates a heightened state of the crisis or freezes and is unable to react to the situation. An ineffective reaction may also result in care providers saying or doing the wrong things that increase the inappropriate behavior of the person in crisis.
Ways to address an ineffective response begin with self-reflection and being aware of situations that cause the ineffective response. Learning verbal and physical techniques to protect yourself and the person in crisis can help with gaining confidence to deal with the crisis situations more effectively.
Tips to remember for successful management of conflict begin with understanding that the person may not necessarily be upset with you, but their own situation. Even though you are focused on the verbal content of a conversation, you must still be aware of the nonverbal cues. Don't be led astray by taking the conversation personally. It is important to build and maintain trust to establish mutual and realistic goals. If there is a perceived lack of respect present in the conversation, the person may begin to defend their dignity, escalating the situation. It is essential that the person's best interests are central to creating a mutual goal. Commitment to following through with decisions to meet a goal is a critical component of de-escalating a situation. This video will provide an overview of managing conflict by establishing mutual goals. Click on the image to access the video. Once a situation has de-escalated, strategies need to be in place to prevent incidences from reoccurring. The CPI Nonviolent Crisis Intervention Training Program uses the acronym COPING. The following guidelines for implementing the CPI coping strategy are: control focuses on the emotional status of all parties involved, achieving emotional and physical control. Orientating focuses on the facts of what's happening and listening to a person's perspective in a non-judgmental way. Patterns examines past behavior and recognizes the triggers that can result in crisis. Investigating seeks alternatives and resources to support behavioral changes. Negotiate a collaborative contract with the individual acting out, focusing on the alternatives to this behavior and outlining the consequences. Give the client the responsibility to control their behavior with ongoing support and encouragement. It is important to collaborate with the individual to help them develop better coping strategies and use the tools provided to prevent inappropriate behaviors. Collaboration builds a better rapport and strengthens the relationship between the care provider and the individual. Fostering respect and dignity can result in improved self-confidence in coping with crisis situations. To gain control of a situation, we need to recognize and understand what causes escalation in behavior. Having the knowledge to de-escalate a crisis situation can help care providers manage and prevent crisis situations more effectively.